Okay, good afternoon, welcome to all. Today we will talk about the organ source points or what is known as Yuan source point. We have to learn about organ source points, Z cleft points, Yuan source or passage points or Leo connecting points. Okay. In addition to sun, mother, all those other points. All have got their own importance. So today we will talk about only Yuan source points, the theory and application. First and foremost, just 1 second. So first and foremost, we have to know we have something known as prenatal key or primordial key. That is a word used in acupuncture, wherein we get all the energy required for all the organs through our DNA or our karma or whatever you can call it. So this energy is fixed in quota. You can only make it work in a most best possible way to its upper limit. You can't go beyond that. But what you can do is use that in a wise manner by adding what is known as postnatal key. Natal means birth. Okay, that is before birth and after birth. So when we say birth, not necessarily baby coming out of the womb. No. The baby taking life. Till that time, it's kidney only which is giving all the mother's kidney. After that, it is the child or the baby, it is there in the womb, that gets the energy for all its organ formation as well as functioning from this prenatal key. Post birth, what happens is stomach becomes operational. That yesterday we were talking about 3 warmers, the upper, middle and the lower warmer. First, when the baby is born, the first thing to become operational is the upper warmer. That's why baby has to cry for its lung to start taking the oxygen. Till that time, everything is fed by the mother through its navel. Here, navel is disconnected. It has become independent once the baby comes out. Okay. So there, it has to start functioning its 3 warmers. The first warmer is the lung and the heart. So that has to start functioning. That's why baby crying will start oxygenation, and that oxygenation goes to brain also. If the baby doesn't cry within that 30 seconds or 1 minute, whatever duration, I am not very sure what is the duration. Let me be very frank. So what happens is birth-related problems can occur to the child because oxygen doesn't reach to the brain. That's why it's very important for the child to cry. That's why the moment this happens, child doesn't cry, it is put in a rather reverse direction and it's tapped on the back. So that the key from the kidney flows to the lungs for the lungs to become operational. Because the birth, as I told yesterday, the breathing in is always we in acupuncture call it is a function of the kidney. Whereas the breathing out, okay, is the function of the lungs. We can see, while breathing in, neither we can speak, nor we can cry, nor we can do anything. It is breathing out only. Okay. When you're taking breath in, you can't. So that is why it is like that. Breathing in through kidneys, breathing out is through lungs. So here we are talking about three warmers. In the three warmers, the first one becomes operational. The second warmer, that is the stomach and the spleen, the middle warmer, that becomes operational subsequently. Okay, then what happens is the postnatal key. One is the key is from the lungs, and the key is from the middle warmer, that is stomach. Okay, goes into adding the energy to the baby. That's why first taking breath in, after that starting feeding after some time. So this is how, okay, the energy starts getting accumulated. But before these two, there is already energy there in the kidney. That is what is known as prenatal key. Okay. So that is there in the third warmer. That is the kidney and urinary bladder. What we talk about third warmer, that is what is the third warmer. Third warmer is already functional before itself. Then becomes the first warmer, then comes the second warmer in that order. Third, 3, 1, 2. It is not 1, 2, 3. Though we call it as first upper, middle, and lower, it is the other way around. That's how the energy flow happens. Okay, this should be very clear. Now coming to organ source point, the prenatal key, what is there? It is like one big source, and it is there in the located, it is told now, between the kidneys. Okay, it is there as a one chakra or whatever you can think about it. So it is there. That is what is the philosophy. This is distributed to all the organs, because each organ has to function. It has got its own responsibility. For example, if parents have got some 5 children, equal distribution of energy or whatever their earned thing is distributed. Same way, this prenatal energy is distributed to all the organs, depending on their requirement. And where does it go? This prenatal key goes to the each organ and is available at what is you are seeing on the screen, the organ source point or yuan source point. Okay. So the first point is the yuan source or organ source points are where the yuan key or the prenatal key, it is pulled in. It is available as a tank for that particular organ for doing its functioning, its own repair, and to carry out the responsibility given. We studied about the creation cycle, okay, and the 5 energy, and each energy having some organs. Those organs having certain responsibility to maintain certain energy as well as doing other things, what is job located to them. So that one is possible only by the key which is available for them. And that key comes from this organ source point. Okay. So on this point, what happens? The key is a combination. Key is a total energy. It has got yin as well as yang. I have told you this yin and yang principle I'll cover in detail. That itself will take 5 to 10 classes, because I don't want to leave anything unturned. I'll cover in detail so that the concept of yin and yang should sit very clearly. Okay. So we'll go slow on that. But here in advance, I will be using yin and yang because all of you are already used to that word. So here the point key transforms into yang and yang to yin depending on the need. Okay. Because organ is one, it has got both yin and yang within it. And it has to carry out its structural, it has to maintain its structure, and it has to carry out its function. That is what is all yin and yang is about. Okay. One is the structure, another is the function. It has to be carried out. For that, this total key is required. So this key is one, what will happen? Each of the 12 meridians, we don't talk about now, the CV and GV, as far as the organ source point is concerned. So we talk about the 12 organs which have got the 12 meridian, and each of that has got a organ source point, including the triple warmer. Okay. So, and it is circulating this key, organ source. What, please note down here what I am trying to say. This is what is important. What is the organ responsible for circulating the organ source key? TW. You cannot undermine the importance of the TW. That's why TW is linked to what? Anyone?
Can you please repeat?
TW is known as what? Which organ?
Spine.
Yes, the spine or spinal cord.
Spine.
Okay, that is what is the TW. Okay, pericardium is the brain. So this is responsible for circulating the organ source key. This is a very important point to be remembered. That's why when you are treating, you cannot overlook TW. Okay, that is what is the importance. In each of these, all the TW, we will see as we go further and take examples and take some case histories and understand how, why do you use these points, etc. We'll go. You need to have patience for that. Slowly we'll go. So this is what is the
Sir, sorry to disturb. As you are saying, postnatal, it is converted to nil means what, sir? I don't understand. Nil means what? Nil means nail.
where
Means
is
I
nil? I
don't-
have not told any word nil.
No, you was telling the sir, so I get confused.
Who is this speaking? Can you tell? I can't see.
Sir, I raised my hand, sir. Sir, this is me.
Oh, okay, okay. See, I told no. Postnatal key also adds on to the prenatal key to make the total key. That's what I didn't say nil.
Yes.
Okay. So postnatal key will come in later, I said.
Huh.
First is the prenatal key. So in the triple warmer, when I talk,
So
the
prenatal key,
lower
sir,
warmer-
so third warmer is already working, na, sir? Prenatal.
yeah,
Yeah.
That
So
is not
after
prenatal.
postnatal.
That's correct. That is prenatal. After that, postnatal, no, the key has to come from both, no, your breath as well as from food.
Stomach, yes.
Yeah, that's what, no. When we learn diagnosis, we teach, no, different types of key. Okay.
Hmm.
There we'll once again touch upon it later on. So you have
Okay, sir.
studied, if you have studied in second semester, we already taught, right?
Okay.
So there now we tell key, lung key, whatever key is there from the lung, as well as key from the stomach and spleen, they mix together to form the total key, right? Okay. Is it clear? Can I go forward?
Yes, sir, please.
Okay.
Sir, can you please explain the last point once again?
Yeah. Last point is, okay. Each of the 12 meridians has got a organ source point. That I'll show you what are those organ source points. Okay. And when I say each of the 12 meridians, including the triple warmer, it is not a physical organ which is visible normally in TW karke. Though we have linked it to our spinal cord, TW per se, there is no organ, right? Okay. That's why we say including the TW. So, and this is responsible for circulating the key. If you want to talk about physiology, anatomy, then also if you see everything, every organ is connected to our spinal cord through nerve centers. The response, okay, through those nerve centers goes to the organ, and from the organ it comes back to the spinal cord, and through spinal cord it reaches to the brain. This is how the functioning happens. Okay, it is also meaning to that. Okay, if you look at that way. Otherwise, if you look at acupressure principle per se, without talking about anatomy or physiology, then also this is the sentence what we are trying to say. The triple warmer is the meridian responsible for circulating this organ source key. Okay, as and when required.
Okay.
So,
Sir, I was
yeah.
sorry, sir. I was talking about the last point mentioned, relationship to the
I have not yet
prenatal-
come to that. That is,
Oh,
I have flashed it.
Oh,
I have been talking to
I
the
thought you
up
were
to the point.
changing the slide.
Okay.
Okay. Thank you, sir.
Yeah. So, what I am telling here, I am telling here, with the relationship to the prenatal key, organ source point indicate the nature of in the body. So, when we say in, it is the, sorry, already gone to the next point. Okay. When we say in, okay, it is the energy, the total energy which is available in a static condition. When I explain yin and yang, I'll tell you, one is the kinetic energy, another is the potential energy. Okay. Yin is the potential energy, stored energy. Yang is the kinetic energy, which is responsible for any movement. Okay. That is what is the importance you have to understand. Here, what I am making, with this relationship to prenatal key, the organ source point indicate the nature of yin in the body. If your yin is sufficient, okay, your prenatal key is good. That is what is the meaning of this. Okay. If in is missing, now I'll come. Next point it is there. There I'll tell about the in further. Okay. So here I'm talking out of these organ source point, I once again split it into two. One is the yin organ source point, another is the yang organ source point. So the yin organ source point, they can be used to tonify the basically 5 in organ. Here pericardium is not being considered that way. That's why we say 5 in organ. Heart, lung, kidney, spleen, and what? You have to keep on interacting. Liver. Okay? Yeah. Rather, I should go in the which order? Though I have written there in a different order, I should go from liver, heart, spleen, lung, kidney.
Lung, kidney.
In this creative order. Okay. So creation order. So we have to go like that. Okay. So these can be the diagnostic tools for these 5 in organs also. And these are also the shoestring point for the in organs. We have not yet talked to in our class now what is a shoestring point, right? Okay. But otherwise, you know, all of you have done first semester. Okay. You know what is a shoestring point. What is shoestring point? Anybody can say?
Third
It is-
point.
Earth point.
Yeah. Correct. What is that?
Also known as yang source point, no sir.
Okay. Okay. You are confused. We will not talk about it. We will not create a confusion as that. We will go there. Okay. When we come there, we'll see. You take it that there are also shoestring points. Okay. For the in organs. Now we will see. Next, the yang points. Okay. The organ source yang points. One is the organ source in point we talked. Okay. They are used not to tonify the yang organs, but to expel pathogenic factors and or release excess pattern. Okay, this is one of the biggest confusions. It happens to many people. Though we talk about organ source points and we say organ source points have to be toned, okay, but Li4, for example, what we say, most of the times we sedate,
Sedate.
right?
Sedate.
That's what we
yes, sir.
say. And we use it also like that. Why is so? I am explaining here. The yang ion points or organ source points are not used to tonify the yang organ, but can be used to expel pathogenic factors and or release the excess patterns. excess condition. Okay. One by one we will see these Young organ source points. Okay. Li4 is 1 for the large intestine, right? It is used to expel heat, especially the wind heat. Okay. Second one, TWO4. It clears heat from the gallbladder. The third one is SI4. It treats pain along the SI meridian. This is excess pattern. Pain is always a excess pattern. All these are sedated. Okay. ST42. Wind cold. That is to be expelled. So we treat ST42. ST42 we use including in teeth pain also. Okay. And stomach heat is excess also. So basically, we want to expel something. ST42 as such, we have got multiple that we'll talk in detail. It is one of the wonderful points. Okay. We use as a single point also. So these are some of the examples how the Yang Yuan source point are not used to tonify the Yang organ, but can be used to expel pathogenic factors and or release the excess patterns. Whereas the Yin organ source points are used directly to tonify. See, yesterday we were talking about, no, in case of a deficiency, I will treat the mother. Here, organ source points can be treated directly. There are multiple ways of treating a deficiency. Yesterday was one way of treating the deficiency, I told, by treating the mother. But you can treat the child itself directly. Okay. That is by organ source point. And when we come to the passage point or Leo connecting point, we'll talk there once again. How we can treat with the deficiency by taking the energy from the sister organ. That is a different concept once again. So you got multiple ways of treating either the excess or a deficiency. That's why it's very important to understand what does each of these do. What is the meaning? Are they just there? So many different names are there. Organ source point, Z cleft point, that point. Should I remember? Should I know? But unless you know, you don't have multiple options. You think there is only one answer, but it is not so. You have got multiple answers for a same problem. Okay. And the last point, GB40. Another wonderful point. Okay. You see, when we talk about the stagnations, liver key stagnation. Sorry. Somebody wants to ask a question?
No, sir. By mistake, she has muted.
Okay. No. Okay. So, GB40, when we talk about stagnation in the body, liver key stagnation is the biggest stagnation. We normally talk about 6 points as a protocol, right? But in that protocol, GB40 is not there. If you look at it, if you remember, okay, liver key stagnation points are liver 3, 13, 14, okay, GB34, TW6 and P6. There is no GB40. Okay. Here I am talking about something. GB40, it can be used to resolve liver key stagnation as a single point and works wonderfully well also. Okay. So we'll talk about this also in detail subsequently on all these points. We'll go point by point. We'll talk about some 60 points which we will use, okay, in various ways. Single, in combination, how do we solve a problem? Okay. Through your interaction only we'll solve. Yeah.
Sir, in these cases like Li4, TW4, can you just give one example where we can help to expel it, just to understand? Because now these words become very heavy to understand.
Okay.
Just one example that where you can use that expel wind heat that way.
Yeah. See, for example, if you have anything, the wind heat is affected your upper, let us say head. Okay. You might have a cold, cough, maybe whatever other function problem, headache. Okay. You can simply, if it is because of the external wind heat, that is external pathogenic factor, only by sedating Li4, that is treating Li4, you can resolve that. When we say pathogenic factor means it is beyond the body, coming from this one. When I was explaining the various energies, I said first itself, the wind has got all other energies within that. Okay. If it is mixes with, if there within the wind, heat becomes more, it will become a pathogenic factor, wind heat. If the cold becomes more, it becomes wind cold. Okay. If humidity becomes more. So like that, different energies become excess. Already in nature also, energy is there. In the body also, energy is there. You are healthy only when the body is closest to nature and trying to always adapt to nature. See, like one of our main important jobs in life is to adapt to life. Body, without telling us, it keeps on adapting to the nature outside. If heat is more, it sweats. Okay. If heat is less, rather cold is more, you shiver, By shivering, what happens is yang energy is created. So like that. So body is always trying to go closer to the nature around it and trying to adapt. But when fails like that, then these external pathogenic factors can create a disease. So then only all these points and all these methodologies, all the different foods what we take to overcome that are useful. Is it clear?
Yes, sir.
Is the time up? Should we log out and come back?
Sir, as just now you have given the example as external wind effect, can we go for the stomach 42 point also, no, sir? Because it is actual wind cold effect के लिए भी है ना वो point.
Yeah, that's what. It is
It
wind
is
cold के
written
लिए.
there,
That is
no?
wind heat के लिए.
But it is written for facial paralysis.
I have
So
given one
it is
example.
not the case of
It is not
paralysis,
only
but
that every time facial paralysis, you just give ST42. Or only ST42 will work. No. It is given one example. Okay. You can do that.
okay, sir, understood.
Yeah.
Sir, one more question. As you said, ki GB40 is a single wonderful point to dissolve liver key stagnation. Then in the normal phase in liver key stagnation, the point which we give generally, why it is not included there?
That I'll come to when I explain liver key stagnation and why that formula has come.
Okay.
Okay. I told there are multiple ways always. Okay. You can go to Bangalore, okay, from Delhi through multiple routes. You can come by air, you can come by train. Okay. You come via Maharashtra, you come via Madhya Pradesh, you come via Chennai, you can come anywhere. It is like that. Yeah. Somebody should answer about the timing aspect. Should I re-log in?
Yeah, yes, sir. It's 1.5 minutes left. So
Yeah, okay. We'll stop here and